Thank you for visiting my channel, Medical Assistant with Miss K. If you're new here, welcome. My name is Kendra, aka Miss K, and I've been a medical assistant since 2004 and a medical assistant instructor since 2011. Now, I know it's been a while since I posted a video here, but I have been extremely busy. So for those of you that have been following me for some time, you guys know that I teach, and I also have been working PRN at a cardiology practice that I used to work at full-time years ago. However, I have recently decided to go back into the office, the cardiology office, full-time for now. I have also shared on the channel that I tend to go back and forth. I worked as a medical assistant and I taught for a couple of years, and I went back to the field and then I taught for a few years again. So I've been teaching consistently since 2017, and now as of, April 2025, as of right now, I will be working full-time in the cardiology practice that I've been working on call for. So I'll still be doing these videos, I'll still be teaching, I'll still be doing study videos and all of that, but I'll be in the office full-time for now, and then of course eventually I'll go back to teaching. So I'm thankful that I have that option to be able to do both and go back and forth. I was doing both for a while at the same time, but you know, when you've been doing this for a long time, you tend to, you know, it can get tiresome. But for the most part, I'll be assistant to manager. So again, I'll still be doing videos. But anyway, I want to, first of all, let me tell you guys this. Please excuse the noise if you hear it in the background. I have two neighbors who both have dogs, and they tend to be arguing. I don't know. They sound like they're having an argument. So I'll wait till they stop, but I have a few videos that I want to record today. I don't have time to wait. So just warning you guys now that if you hear barking in my background, that's the two dogs out there having an argument. But anyway, in this video, I want to talk about a question that I get a lot, and that's advice on working in a pediatric office. And the more specific question that I got is working in the pediatric office on externship. Now, I've done videos on tips for externship, and I'll touch on that as well. But this is going to apply whether you're working at a pediatric office, just, you know, as employment or externship. One of the first things that I'll share is that you want to be warm and friendly when you're dealing with kids, okay? Now, if you're just starting out, especially if you're an externship, it's normal to be nervous, but you know, kids, they can kind of feed off your energy. So if you're acting nervous, they're going to act nervous. It's already going to be some kids that's probably going to start crying instantly when they see you. That just happens because a lot of times kids, when they see your scrubs, or even your lab coat, they automatically think back to getting a shot, right? Getting a vaccine or getting their blood drawn. So you gotta kind of be prepared for that, but you want to just be friendly. You want to be calm, right? And you want to kind of, you want to get on their level as well. Whether you have to stoop down and talk to them or have a seat, you just kind of want to make them feel comfortable. You definitely want to smile a lot. You know, be a little playful. You can't be, you know, very serious when you're dealing with kids. You want to just be playful, have a nice, friendly tone. You want them to trust you. So you can even ask them, you can kind of give them a choice. And, you know, if you got to, let's just say you got to do a hearing test on them, right? You can probably say, well, which ear do you want to do first? Your right ear or your left ear? You know, kind of feel like they're having a choice, okay? You want to just laugh and be playful with them. Even if you're checking their blood pressure manually, right? You want to just kind of laugh and say, oh, I can hear your heart beating. Wow. You know, just something like that. Like, your heart is beating so strong. You know, you just want to kind of be a little animated, right? And friendly. Be fun, right? That's what I mean. Be fun. And one of the things you do want to do is learn the office flow early on. So especially for those of you that are on externship, I always recommend having a notepad when you go for your externship so you can take notes as they're teaching you and showing you how things work. So you want to find out how the office flows there. Like every time a child is there, you know, if they're there for a well child visit or physical, all of the things that you have to do. Like this usually includes your hearing, your vision, tests. If it's a baby up to 3, you're doing head circumference, height and weight, you know, and things like that. So you want to get an idea of everything that you need to be doing for that child. Also, make sure you know how to handle sick visits, because there's a difference between when a child is coming in for a routine visit versus a sick visit. So if the child is coming in for a sore throat or fever, make sure you know how things are run in your office, because for some offices, they want and because you're supposed to have an order when you're doing a procedure anyway, any type of test or anything, but your office may be set up to where if the child is having a sore throat, the doctor gives you that permission to go ahead and do a strep test, and they may even pre-order it, or some offices will allow you to put the order in and then the doctor signs off on the order. So just make sure you find out how the office is run when it comes to sick visits versus well child visits versus follow-up. Also, get comfortable checking vital signs on a pediatric patients. Now, working with pediatric patients is a lot different than working with adults. Okay, if you're working with the little kids, they're going to be squirmy, they're going to move around. Some of them may even cry and not want you to touch them. So you want to start getting comfortable with that. And you want to also make sure you're familiar with the abnormal ranges for vital signs when it comes to pediatrics, because it's a little different from adults. You know, with adults, our heart rate and our respiration rates are a lot lower than pediatric rates. So just making sure you know the differences between the two. So that way, if you come across anything that is abnormally high or abnormally low, you report that to the provider right away. And also knowing the difference between, different stages, because how you handle a 2-year-old patient isn't the same way you'll handle a 12-year-old patient. So just being able to work with different age groups, and early on you can kind of watch your teammates or the person that's training you, your preceptor, you can kind of watch how they do things, and then you can adopt those ways, or you may even find your own ways of doing things. And you want to be prepared to do a lot of immunizations. Okay, when you're working in a pediatric office, you most likely will be given vaccinations all day long. So you want to make sure you are verifying your patients. Of course, your 7 rights of medication administration. The same applies when it comes to pediatric, making sure you have the right dose, making sure you have the right medication. When you're choosing your medication and you're going to the refrigerator, the cabinet, or wherever you're retrieving your medication from, you want to make sure you check it, recheck it, and check it again. Okay. There are some medications that are very similar in name. For an example, there's Hep B, right? HEPB is on the bottle, and then there's HIB. And so when you're going to grab those medications, you want to just make sure you're grabbing the right medications. Now, pediatric and adult medications should be separate anyway, but you definitely want to make sure you are double checking, because someone could have accidentally put an adult medication in the pediatric area. So it's going to be on you to make sure you're grabbing the right medication, giving the right dose, of course, having the right patient, verifying their name and date of birth, making sure you're giving the right technique, the right route, right, and then documenting the right documentation. And another thing to keep in mind when it comes to vaccinations, you may have to get some help. So when I was working in pediatrics, there were many times where a co-worker and we had to work together to give the vaccines to a child, because maybe the parent had multiple kids. The parent had one child in a hand, in their arm, had a baby in their arm, so they couldn't really hold the child down and needed a vaccine. Or maybe the parent wasn't strong enough, right? It's so many different things you can run into. So you want to kind of be prepared to kind of, call for reinforcement, ask your coworker, or even be prepared to assist your coworker when it comes to giving vaccines. And one thing I'll say too, never tell a child that it's not going to hurt. So whenever a kid would ask me, is this going to hurt? I would always respond, well, this is going to be really quick, just something like that. Don't ever say it's not going to hurt, because guess what? When you lie to them, you lose their trust, because you don't want to say it's not going to hurt, and then it does hurt. Okay. I would just say it's going to be so quick. It'll be over before you know it, and I let them choose which arm. That goes back to kind of giving them a choice, making them feel like they are a part of, what's going on. Which arm do you want to do? Okay. Asking them which arm or leg they want to do, things like that, just making them feel comfortable. You also got to be patient with the parents as well. So that's another thing when it comes to pediatrics, is that you have your patient and then you have the parent. And then sometimes the parent can be nervous. Sometimes the parent can feel overwhelmed. Sometimes the parent can be even worse than a child. And so you got to be patient, be ready to answer questions and explain to the parent what's going to be going on. And also sometimes you may even have to let the parent know how important it is for them to pay attention to what you're doing to their child. So I had a parent who wanted to leave out the room when I was giving their small child. I can't remember how old the child was. It wasn't an infant. Maybe, if I had to guess, maybe about 2 or 3, but she didn't want to stay in the room. And I said, I know you don't want to see your baby getting the vaccine. However, I need you to stay in the room, because I need you to be able to see, you know, what I'm giving your child, what I'm doing to your child. And so sometimes you do have to do that. Sometimes you're going to have parents that are just, you know, micromanaging you, watching your every move, you know, because they want to see what you're doing to their child. And I get it. I'm a parent, so I get it. You want to make sure they're giving the right thing and doing it the right way and all of that. So just be prepared. Sometimes, like I said, parents can be nervous. They can be overwhelming. Or overwhelmed. They can feel overwhelmed themselves. They can be nervous. They may have a lot of questions. So just be patient with the parents as well. And specifically when it comes to externship, or maybe it's not an externship for you, maybe you're brand new to working in pediatrics, make sure you ask plenty of questions, okay? Never assume. If you're unsure of something, never assume. It's okay to ask them to show you something several times before you do it, or even have them demonstrate it for you, especially if you're on externship or brand new to medical assistant. They already know that part of what they do is training, right? They know, especially if you're brand new, they know that that's going to come, you know, having to demonstrate multiple times, it comes with training. So they get it. You know, hopefully you get someone that's very patient, but it's okay to ask questions. It's better to ask too many questions than to assume. And this is why you want to have the notepad, right? This is why you want to take notes, so that way you don't have to keep going to them with the same questions over and over. Another thing too, make sure you're taking initiative, especially those of you that are on externship and you're trying to get hired. Anytime you have downtime, you want to be doing something. I always say, even if you got to go out into the lobby, into the waiting area and straighten the magazines or wipe off the seats, just always be doing something. Take initiative. Ask your coworkers if they need help with anything. If they need, maybe their rooms need to be stocked, or maybe some table paper needs to be changed. Just take initiative and do it. Even if you walk past a room and that wasn't your patient, that's not your room, that's not your provider. If you see a table needs to be changed, just change it. If you see something that needs to be done, just do it. Because, you know, you want them to see that you take initiative, that you're a hard worker, right? And you want them to tell you to sit down, right? If things are slow and you're still working, you want them to say, listen, you're okay. It's okay to sit down for a moment, rest your feet, you know, let them be the one to tell you that. Please stay off your phone. Do not be on your phone. Do not be on social media. Do not be, you know, doing personal stuff on your phone and on the company's computers. Just be very extremely professional. And also make sure you're getting there on time, right? Not actually early. Get there a little early. So if they start at 8, I will be in that parking lot 7:30, 7:45, even if you got to wait outside before they open the door. It's better to be early than late. Stay organized and sanitary, okay? As I mentioned, you're going to be taking notes. Keep your notes in a certain section. Sanitary, sanitizing after every single patient, and especially if a patient is sick. When you're in pediatrics, you're going to be dealing with a lot of sick kids. You're going to have a lot of kids coming in with things that are probably going to be contagious. So you want to make sure you're sanitizing and disinfecting between each patient, cleaning, wiping off the tables, anything you use for that child, make sure you're disinfecting it. Also, of course, changing the table paper, that goes without saying, and any other measures that you have to take depending on what the previous patient in that room may have had, especially if it's something that's contagious. Another thing that you may want to consider doing, which is completely optional, is maybe keeping like a list, like a tracker, a checklist of things you've learned, things that you've done for the day. I actually have a printable tracker, like it's like a log of things that it's not an official log or anything. It's just something for yourself. Actually, some schools require that you do something like this, but this is completely optional. Just something that you may want to do if you're brand new to medical assistant. This is your first job or your first time working in pediatrics, or you know, you're on externship. It's just a way of keeping track of things that you did today. So like on a log, it'll say today I saw 5 patients. These were some of the diagnoses, some of the diagnoses I've seen. I had a patient with strep throat. I had a patient who came in with a fever of 104. This is what the provider did. You know, things like that. Where today I gave 4 injections to one patient. Like, this is how they reacted. This is what I would have done differently. This is what I'm proud of. Just things like that. So that's optional. I'll leave it in the description. Free, download it. You can print it and just kind of, you know, check it off as you do things, or just use it, like I said, as a log to keep note of things that you're doing throughout the day. So hopefully this was helpful. If I think of anything else, I'll definitely come back with another video. Let me know in the comments if you are currently working in pediatrics or about to start, whether it's externship or a brand new job. Let me know. And let me know anything that you would add. For those of you that already work in pediatrics, I'm sure I'm missing some things. And so feel free to add it in the comments below. Also, make sure you guys check out my site, shopwithmissk.com. You guys know I sell these customized necklaces. Make sure you leave the note when you guys order these. Some people forget to leave the note on the shopping cart page. You just leave the name that you want on it, okay? Also have these medical assistant t-shirts. As you can see, this one here, it is the ingredients of a good medical assistant, right? So kindness, honesty, reliable, and things like that. So I have several different medical assistant t-shirts. You can check those out there. Also, if you're preparing for certification, my MA refresher course is for you at marefreshercourse.com. That's also in the description. It's also for people who have been a medical assistant for a long time and you just need a refresher, right? Whether you got certified years ago and you just need to get, you know, just brushed up on it. You've kept up with your certification, but you need to be brushed up, or you never got certified at all. This is for you. Or some of you have been working in the capacity of a medical assistant, but never went to school and never got certified. It's also for you. So thank you guys again for visiting my channel. Be blessed.